Greetings. I'm Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, and I'd like to share with you an editorial in the January 2015 issue of Mayo Clinic Proceedings entitled Mayo Clinic Proceedings 2015 as we move forward. This is one in a series of editorials I've done over the last few years to inform readers of the current status of the journal and our efforts to improve the journal and initiate new programs in the upcoming year. Mayo Clinic Proceedings had a very good 2014, and by year's end we had a print circulation of 127,000 per issue. This ranked as the third largest print circulation biomedical journal in the world, regardless of genre. We also had a very good year for our impact factor. It had come up for 13 of the past 14 years, a rarity among biomedical journals, and was 5.812, ranking number 11 out of 150 general internal medicine journals. We also had good success with our website, YouTube, Facebook, and Twitter activities, such that thousands of people were accessing journal content through these methods each and every day. Added to this, we also had historic success with media coverage and distribution of our content in 2014, such that our stories were presented to, heard by, or distributed to more than 1 billion people in 2014. Based on the rates of growth in the recent years, we anticipate that this number will go up considerably in 2015. Certainly this type journal growth would not be possible without outstanding authors sharing their high-quality content with us. We also depend on input from voluntary peer reviewers and editorial board members to help us vet the materials that authors share with us and determine which of those should be published in the journal. In all instances, we try to be respectful of the needs of the authors so that whether their materials make it into the proceedings or not, we are able to provide them an educational critique on the strengths and weaknesses of their manuscript. Authors have been very receptive to this approach, and I will share with you some stories about our exchanges with authors. When Mayo Clinic Proceedings began in 1926, all of the content was focused on Mayo Clinic authors and research done at Mayo Clinic. Based on projections at the time the January 2015 issue went to press, approximately 18% of all submitted manuscripts now come from Mayo Clinic. Half come from outside the United States, and the remainder are from non-Mayo Clinic authors within the United States. We depend on more than 550 reviewers each year to help us evaluate those manuscripts. And I will share with you where those reviewers come from and the type work they do for the proceedings. I also will share with you in the editorial the criteria we use to determine which manuscripts have the highest priority for eventual publication in the proceedings. Certainly, these positive aspects of our operations have not escaped the notice of authors, and we're receiving historically high numbers of manuscripts at the end of 2014 and early 2015, such that our acceptance rate, which was once more than 60%, is projected to be approximately 15% in 2015. In the editorial, I will share with you how we determine the core content of the journal and also special collections that we arrange. The journal focuses on topics that are critical to the core of medical practice and introduce authors to new subject matter, help them clarify and place into perspective controversial issues, and employ a mixture of science, humanities, economics, healthcare delivery, and other topics to provide a balanced representation of the challenges and solutions that confront contemporary physicians. The journal also publishes special collections of articles. In 2014, the journal published a collection of an editorial and 4 commentaries celebrating the 150th anniversary of Mayo Clinic practice in Rochester, Minnesota. We have collated these articles along with other content, for example, historical photographs and quotes from the Mayo brothers, into a book entitled Mayo Clinic Sesquicentennial Commemorative, 150 Years of Serving Humanity Through Hope and Healing. This book is available for purchase on our website. In 2015, we will conclude the symposium on regenerative medicine. By its completion, the series will have approximately 18 articles. In this January 2015 issue of the Proceedings, we will also begin the Symposium on Pain Management. This issue contains an introductory editorial and the first article of the series. The series will run throughout 2015 and into mid to late 2016. Also, in the summer or early fall of 2015, we will introduce yet another new symposium, Neoplastic Hematology and Medical Oncology. This series will run throughout the remainder of 2015, 2016, and perhaps into early 2017. I will share with you how we are disseminating information in multiple forms and the techniques we use to cross-reference those forms so that you as a reader can be better informed. For example, in 2015 we will introduce the use of QR codes or quick reader codes to help you move among various forms of communication for a single topic or help you identify multiple related articles on complementary topics. I also will share with you information on the Proceedings Writing and Publishing Education Outreach. In this program, members of the Proceedings Executive Committee have a list of topics that they have presented to a variety of academic venues. I will share with you the scope of these activities, and I will tell you how it will be possible to petition the journal so that perhaps we can deliver one of these programs at your institution. In closing, those of us who lead the Proceedings thank you for your ongoing support and loyalty as we try to make the Proceedings the best biomedical journal possible. We hope that you will share with us an excitement based not just on the accomplishments to date, but instead on the unlimited possibilities as we move forward. Thank you. We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.